नमस्कार दोस्तों, आपका स्वागत है मेरे YouTube चैनल निर्जा होमियो गाइड में और मैं आपके साथ डॉक्टर ज्योत्सना सिंह। तो अगले कुछ सीरीज़ में हम लोग AIPGT के लास्ट 5 ईयर्स के क्वेश्चन पेपर सॉल्व करेंगे। लेट्स स्टार्ट विथ AIPGT 2017 क्वेश्चन पेपर। ऑल ऑफ द फॉलोइंग प्रोवाइड अटैचमेंट ऑफ द ट्रेपीजियस मसल्स एक्सेप्ट। तो ऑप्शन जाने से पहले सबसे पहले हम क्वेश्चन को समझेंगे कि ट्रेपीजियस मसल्स के अटैचमेंट के बारे में कहा गया, बट लास्ट में पूछा गया एक्सेप्ट, यानी जो 4 ऑप्शन दिए हुए हैं उसमें से एक ऑप्शन नहीं होगा। ठीक है, तो ट्रेपीजियस मसल्स का जो ओरिजिन है, फर्स्ट मीडियल 1/3 ऑफ द सुपीरियर नक्कल लाइन, नेक्स्ट एक्सटर्नल ऑसिपिटल प्रोटूबरेंस, थर्ड वन इज द लिगामेंटम नक्काई, फोर्थ C7 spine, fifth T1 to T12 spine, and last is the corresponding supraspinous ligaments। और इसका जो इंसर्शन है, इंसर्शन से इसका जो अपर फाइबर का है इनटू द पोस्टीरियर बॉर्डर ऑफ द लेटरल 1/3 ऑफ द क्लेविकल, मिडिल फाइबर into the medial margin of the acromion and the upper lip of the crest of the spine of the scapula, and the third one is a lower fiber on the deltoid tubercle of the medial end of the spine with the bursa intervening। तो इससे हमें पता चल गया इसका ओरिजिन है इंसर्शन। तो अब देखते हैं इसके ऑप्शंस। ऑप्शन में दिया हुआ फर्स्ट रिब, ऑसिपिट, क्लेविकल एंड स्कैपुला। तो हमारा जो आंसर होगा वो फर्स्ट रिब होगा। इसको छोड़ के बाकी तीनों जो ऑसिपिट, क्लेविकल और स्कैपुला है वो ट्रेपीजियस मसल्स को अटैचमेंट प्रोवाइड करते हैं। नेक्स्ट क्वेश्चन, तो स्टर्नल एंगल इज द लैंडमार्क फॉर लोकेटिंग द लेवल ऑफ फॉलोइंग। First one is the second costal cartilage and the rib lie at the level of the sternal angle. Second, it marks the plane which separates the superior mediastinum from the inferior mediastinum. Third, the ascending aorta ends at this level. Fourth, the arch of aorta begins and also ends at this level. Fifth, the descending aorta begins at this level. Sixth, the trachea divides into 2 principal bronchi. Seventh one is the azygous vein arches over the root of the right lung and opens into the superior vena cava. Eighth, the pulmonary trunk divides into 2 pulmonary arteries just below this level. Ninth one is a thoracic duct crosses from the right to the left side at the level of the 5th thoracic vertebra and reaches the left side at the level of the sternal angle. 10th one is it marks the upper limit of the base of the heart, and the last one, the cardiac plexus are situated at the sternal angle. So now we will see the option में दिया हुआ है jugular notch, second costal cartilage, defied process and costal margin. Answer will be the second costal cartilages. Next question, interventricular septum of the heart is supplied by. Answer will be the second, anterior part by the left coronary artery and the posterior part by right coronary artery. Hepatopancreatic ducts open into which part of duodenum? Answer will be the second part of the duodenum. Next, bone devoid of muscular attachment is. Option is a cuboid, cuneiform, navicular, talus। तो चारों ही जो बोन है वो टार्सल बोन है, लेकिन जो क्यूबॉइड, क्यूनिफॉर्म और नेविकुलर जो है वो उस पर मस्कुलर अटैचमेंट है, एक्सेप्ट द टैलस। सो आंसर विल बी द टैलस विच इज़ डिवॉइड ऑफ मस्कुलर अटैचमेंट। वहाँ पर मस्कुलर अटैचमेंट नहीं होता, वहाँ लिगामेंट्स होते हैं। नेक्स्ट, बोथ ग्लोमेरुलर फिल्ट्रेशन रेट एंड द रीनल प्लाज्मा फ्लो आर इंक्रीज्ड बाय। Answer will be the second, dilatation of afferent arterioles. Next, isoelectric part of ECG that represents complete depolarization of the ventricle is। तो सबसे पहले हम लोग जानेंगे कि ECG के कौन से वेव्स क्या रिप्रेजेंट करते हैं। तो P वेव आर्ट्रियल डिपोलराइजेशन, QRS वेंट्रिकुलर डिपोलराइजेशन, T वेव ventricular repolarization, ST segments complete depolarization of the ventricles, and PR interval is the onset of arterial and ventricular depolarization. So answer will be the ST segments, which represents complete depolarization of the ventricle. Next, pulse pressure is. So what is pulse pressure? Pulse pressure is a difference between systolic and diastolic blood pressure. So it will increase with increase in stroke volume. Now the answer, we will see the option, highest pressure measured in arteries, lowest pressure measured in arteries, decrease with decrease in the compliance of arteries, and increase with the increase in stroke volume. So answer will be the increase with increase in stroke volume. Which of the following statement is true about the rods of retina? Answer will be, rods are more sensitive to low intensity light as compared to cones. Next, while spinning to the left, the eyes of the dancer snap quickly to the left. This fast eye movement is known as. The option is given ataxia. So ataxia means lack of voluntary coordination of muscles movement, which include gait abnormality, speech changes, and abnormalities in the eye movement. Second option, aphasia, which means language disorder that affect a person's ability to communicate. Next, nystagmus, and it is a series of involuntary rhythmic oscillation of one or both eye. Last option is apraxia, yani loss of the ability to perform a pattern of movement through the patient understand its purpose and has no motor or sensory deficit. Now we know the all four options, so we can easily find out the answer, and the answer will be nystagmus. Next question, the protein casein is present in the milk in the form of, so it is present in the form of calcium casheognate. Okay. Next, number of years of healthy lost due to ill health and disability or early death is defined as disability adjusted life year. It is a sum of year of lost life due to premature mortality plus year lost due to disability. Answer will be the disability adjusted life year. The standard difference of insecticides, aerosol, space spray recommended by the WHO consists of, answer will be the pyrethrum. Next, which of the is not a variable in Kuppu-Swamy scale for measuring socio-economic status? तो कुप्पू स्वामी जो है वो फर्स्ट टाइम आया था 1976 में टू मेजर द सोशियो इकोनॉमिक स्टेटस इन अर्बन एंड रूरल एरिया. सो उसमें इंक्लूड था एजुकेशन, ऑक्यूपेशन एंड टोटल फैमिली इनकम. सो द आंसर विल बी टाइप ऑफ हाउस विच इज़ नॉट अ वेरिएबल. नेक्स्ट, इंडिकेटर ऑफ virulence of a disease. So virulence of disease is a case fatality rate. Next, tattoo marks can be recognized even in decomposed body by the presence of. Option is epidermis, hair, muscles, lymph node. So we should know that in case of dead bodies, if the tattoo mark appears to invisible, then the pigments can be detected in nearest lymph glands. So answer will be lymph node. Next question, speedballs are prepared from heroin and cocaine. Next question, a 18-year-old college student presented with erythematous itching lesion on the wrist. On examination, papules and vesicles were noted in a band-like pattern around wrist along with oozing. The most probable diagnosis is. So there is a key point in this question that age of the student is 18 years. And the papules or vesicles, there is a pattern, band like pattern around the wrist. Okay, so we can see the option, seborrheic dermatitis, which is a scaly patches and red skin mainly on the scalp. Herpes simplex, virus causing contagious sore around the mouth or genitals. Contact dermatitis caused by contact with certain substance. And urticaria, which is a localized or generalized eruption forming wheals or hives. The lesions are extremely itching, little discomfort with low-grade fever. And blood examination shows eosinophilia. So we can easily find out the answer, band-like pattern. It means contact dermatitis. Next, a 15-year-old girl gave a history of well-defined small circular pink scaly lesion on her back, followed by a widespread papillus squamous eruptions typically arranged in a symmetrical tree-like pattern on trunk. There was no lymph node enlargement and no oral lesion. The most probable diagnosis is. In this question also there is a key point that lesion looks like a symmetrical tree-like pattern on trunk. So we can see the option. Tinea versicolor caused by the Malassezia furfur, small white spot appear on the trunk, neck, upper arm, face, but there is no itching. Lesions are velvety, faintly brown, varying from 4 mm to 5 mm in diameter. Another option is lesion planus, which is a group of flat-topped erythematous or purplish papules showing crisscross appearance on the flexor surface of the skin with symmetrical distribution. Next option is the pemphigus, which means occurrence of flaccid bullae on the skin and the mucous membrane, or which breaks easily, leaving behind a raw surface resulting from an antigen antibody. The next is a Pityriasis rosea, and the answer is this one only, the Pityriasis rosea, in which there is a symmetrical tree-like pattern on a trunk. Okay. Next question is, a 56-year-old diabetic and hypertensive male suddenly develops a weakness of the left side of his face along with the weakness of the right arm and leg. He also has diplopia on the left large graze. Identify the site of the lesion, and the site of the lesion will be the left side of brain. A 55-year-old female presented with repetitive severe pain for brief duration on right side of the face, which started after exposure to cold. No other symptoms or physical signs were present. The most probable diagnosis, and the diagnosis will be the trigeminal neuralgia, because there is a chronic pain condition affecting the trigeminal nerve in the face. So answer will be trigeminal neuralgia. Which of the following is not the feature of Graves' disease? So first we should know what are the features of Graves' disease. The features are goiter with bruit, sinus tachycardia, exophthalmos, atrial fibrillation. Now we see the option. In option it is given in goiter with bruit, sinus, bradycardia. So this is feature of Graves' disease. Next, all the following are consist with non-proliferative diabetic retinopathy except, यानी नीचे के जो ऑप्शन दिए हुए सारे नॉन प्रोलिफरेटिव डायबिटिक रेटिनोपैथी के हैं एक्सेप्ट. सो जो डायबिटिक रेटिनोपैथी है उसके दो स्टेजेस होते हैं, प्रोलिफरेटिव एंड नॉन प्रोलिफरेटिव. सो proliferative consists of neovascularization. It is a hallmark of the proliferative diabetic retinopathy. The answer will be neovascularization. All three are the property of non-proliferative diabetic retinopathy: macroaneurysm, blotch hemorrhage, cottonwool spots. Next question, bamboo spine is seen in. So bamboo spine is seen in ankylosing spondylitis. Next, malabsorption resulting from the intolerance to wheat, gluten and similar protein found in rye barley is seen in. The given all four options causes malabsorption. Option is short bowel syndrome. So it is a clinical problem that often occurs following resection of varying length of small intestine. That's why there is a malabsorption. Second option is tropical sprue, which is also inflammation of intestine, and there is difficulty to absorb folic acid and vitamin B12. Or another option is Whipple's disease. The disease with CNS manifestation, and there is malabsorption of fat and carbohydrate. Last option is celiac disease. Celiac disease is a malabsorption of gluten, that is barley, rye, oats and wheat. And we also know that our Miss Universe Harnaaz Sandhu is also suffering from the celiac disease, and the answer is celiac disease.